Ungear, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of OEM and the Nashville Fire Department are here with us to help answer your questions. If you'd like to ask a question over the air during our Q&A session, please click the raise hand button next to your name at any time during the broadcast. We'll now begin with Mayor John Cooper.
Thank you, good morning, and thank you for joining us today. First and foremost, I want to extend my heartfelt condolences to the family of the 73-year-old man who passed away from complications from coronavirus yesterday. This loss of life reminds us that while the majority of people diagnosed with coronavirus have mild symptoms, the virus can be life-threatening, and we need to take steps to protect ourselves. Dr. Jahangir will discuss this in more detail, and both he and Dr. Caldwell are here to answer questions. Now, I'm grateful to our first responders, our health department, and every single healthcare worker in Nashville, the nurses, physicians, technicians, and administrative and support staff who are on the front lines of Metro's coordinated coronavirus response. Yesterday afternoon, Dr. Jahangir and I conducted a conference call with over 250 faith leaders, and we urged all houses of worship to temporarily pause in-person services. The faith leaders we spoke to with support the common goal of keeping Nashvillians safe as we all continue to practice our faiths, including Minister Robert Gardenhire of Schrader Lane Church of Christ, and I just want to quote him in saying that suspending our physical assemblies is showing our faith, not suspending our faith. Our prayers will be heard, though we may not be in the pews. Now, with the support of the faith leaders who attended yesterday's call, we've proclaimed tomorrow a citywide day of prayer to lift up all Nashville residents during this difficult time. Another way we can help lift up our community is to support the hardworking individuals in our hospitality industry by placing takeout and delivery orders. For all of those who are doing this, thank you. And for all those who are serving, thank you. To help local small business owners and employees, we supported the Metro Beer Board in passing emergency regulations that temporarily allow delivery and curbside service. I want to thank Board Chair Brian Taylor and Benton McDonough, Executive Director of the Metro Beer Board, for their leadership and assistance. COVID-19.nashville.gov is updated many times a day with public health information and the status of Metro government services. Now, you can also contribute to the COVID-19 Response Fund, created with the help of the United Way of Greater Nashville, to support Nashvillians facing hardships during this time. You can also apply for help through one of the grantee organizations listed on the COVID-19 Response Fund website. Now, I'd like to turn this over to Dr. Alex Jahangir for additional updates. Thank you very much.
Good morning, and thank you, Mayor Cooper. I want to join and express my condolences to the family of the first COVID-19 fatality in Metro and Davidson County. Our sympathies truly go out to his family and friends. This news underscores the urgency of our efforts to combat this virus in Nashville. As of this morning, we have had a total of 133 confirmed cases. That's an increase of 23 cases in the past 24 hours. The patients range in age from 11 to 73 years old. Of the confirmed cases, 2 are currently hospitalized. 111 cases are self-isolating at home and have mild and manageable symptoms. And 19 people who were confirmed cases have recovered and are now cleared. Yesterday, under the orders of Dr. Caldwell, the director of Metro Health Department, all restaurants in Metro Davidson County can serve food to customers only through takeout, drive-through, deliveries, and curbside pickups. No customers are allowed to dine in. In addition, the Metro Health Department has ordered the closing of all gyms and workout facilities. We have also issued a public health advisory urging all churches to help us and hold services where no more than 10 people gather. These decisions are in line with the CDC recommendations and will help us flatten the curve of this virus. We will continue to assess the current situation, and if needed, we will take new steps to protect our community and keep our citizens safe. We have also an update on the launch of our community assessment system. As you know, we are creating a hotline and assessment centers around the city. We will open them when we have the supplies we need, as well as when we have the supplies to keep our healthcare workers safe. We are working with our state, federal, as well as private sector partners to make this happen. This assessment system will be in addition to our already robust healthcare system in Nashville, a healthcare system that is currently responding to the needs of our community. Now, you have heard me say this before, but I'm going to repeat it. Everyone watching our press conference must do our part to help slow the spread of this disease. We must practice common sense social distancing. Please stay away from crowds, wash your hands, and if you're sick, stay home. We've been getting a lot of questions about the virus on social media. People want to know, is it safe to handle money? They want to know whether it's safe to touch takeout bags of food from restaurants or packages that are delivered to their houses. The answer is that there's no evidence that handling money or to-go bags or packages contribute to the spread of the COVID-19 virus. But take precautions. The CDC has recommended that individuals wash their hands after touching physical objects and avoid touching their mouth, nose, and face. Another question is, should you wear a face mask to protect yourself from COVID-19? The answer? You should only wear a face mask if you are having symptoms of COVID-19, especially coughing or fever, or if you have had close contact with someone who is suspected or confirmed to have COVID-19. If you're not sick or you're not looking after someone who is sick, then there is no need to wear a face mask. People are also asking if it's safe to go to the grocery store. Yes, but take precautions. Try to shop when it's not crowded. Wipe down the shopping cart handle with a sanitizing cloth. Keep your distance from people and only touch items that you're going to buy. And as always, to get answers to other questions, go to covid19.nashville.gov. Finally, to my fellow healthcare workers, our world-class healthcare partners, plus the men and women of Metro government and all of you, we are all in this together, and together we will make a difference. Thank you so much for your attention, and stay safe.
We will now start the Q&A portion of today's briefing. As time allows, you can click the raise hand button next to your name. I will go off camera to announce your name aloud, and you may proceed by asking your question on the air. Peter White.
This is Peter White from the Tribune. Is Chief Swan there?
Yes.
I'm sorry, I didn't hear you. Yes or no?
Yes, he is.
Chief Swan, I have a question for you. Your first responders, are you worried that some of them may be carrying this virus and not know it? Would you like to see them tested so they can do their job if they need to without problems?
Yes, this is Chief Swan. That's a great question. Look, we've been stating this fact from the beginning. There's nothing more valuable to any organization than its own people. We practice wearing our personal protective equipment on every call. We've been doing this from the very existence of our firefighter/EMT process or system. So what we have been working with the fire department on every call, we've always wear our PPE, and now we just have a more conscious awareness of the COVID-19. We anticipated the shortage of PPE So our logistics department had actually ordered extra, so we're very comfortable with knowing we have all the proper PPE that's needed. I will credit Brian Jones for looking ahead as far as anticipating this. Now, as far as some of the things that we've done within our department, each morning it's been regulated that we do a temperature check. We do it in the AM and PM for oncoming and offgoing personnel. If they show signs of a temperature, they call our safety officer, safety office, and then from there, they're given information on what to do next. So we are taking all the precautionary measures that we can in order to still provide the service to our citizens, but always with the awareness of the COVID-19 and taking care of our personnel.
I didn't see any other questions today, so a video recording of this broadcast will be made available later on. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.net.